Hi, this is Dr. Kurt Woeller for Integrative Medicine Academy. The title of this video is Vitamin D Types, Healthy Levels, Testing and Function. So vitamin D we know is very important for many things in our body, from bone metabolism to neurological health, immune system support. And there are some convenient tests on the market, including Great Plains Laboratory, their dried blood spot, which is quite convenient for patients to do at home, is a great way to assess for overall vitamin D levels. So let's first talk about some basic function of vitamin D. We know that vitamin D is necessary for the immune system, as I mentioned, muscle metabolism, bone formation, growth, and repair. It regulates normal levels of blood calcium as well as phosphorus, helps to reduce inflammation, and it plays a big role at the cellular level, particularly at the nuclear level, with regards to influences on gene expression that regulates proliferation, differentiation, and even with regards to cancer, apoptosis. Now, 25 hydroxy vitamin D, also sometimes just called 25D, is the combined measurement of D2 and D3, and I'll define those here in a second. And this is the major circulating form and a good indicator of vitamin D status. Has a half-life of about 2 to 3 weeks. So we know that deficiencies of vitamin D increase various issues with regards to cancer, cardiovascular disease, osteoporosis. In fact, in reality, low vitamin D is actually associated with an increased risk of all-cause mortality. Now, in the United States, about 70% of American kids aren't getting enough D. 9% are considered deficient, about 60% are suboptimal. And when we look at globally, the estimates are is about 1 billion people are deficient in vitamin D. Think about that. That's almost, what, 1/6, 1/7 of the world's population. It's a huge number. Now, the range for adequate vitamin D is reported between 40 nanograms per ml to 80 nanograms per ml, generally getting above 50. Some authors report, above 60, but in general terms, around 50 or so is considered ideal amongst many integrative medicine resources. Now, one of those resources is the Vitamin D Council. You can get more information, updated information, by visiting their website. In the past, they have discussed levels above 50 nanograms per ml is considered ideal. They have research, they have a blog site, other information. And so patients often ask, well, how much vitamin D should I take? And the problem with that is that there is no one size fits all when it comes to vitamin D. So some example ranges would be 5,000 to 10,000 IUs daily for adults, or 1,000 to 3,000 IUs daily for children, for example. But again, that's an example because really we have to tailor the individual vitamin D to a person's vitamin D levels. Some reports talk about anywhere between 1,000 to 2,000 IUs per 25 pounds body weight as a kind of a conservative approximation of what a person might need, or you could get more aggressive with something like 300 IUs per kilogram per day. Some docs will even just do between 35,000 to 50,000 IUs per week. And then in some cases, people who are extremely low, even doing sort of a shotgun approach, 50,000 IUs, for example, a couple times a week for a few weeks, and then retesting to see where the levels are. So there's not a one size fits all. These are just examples. So, but what is necessary is consistent testing. Okay, that could be initially where we're doing it every maybe 4 to 6 weeks for a few cycles, so we can see what the levels will be, and then have individual perhaps do testing every 3 to 6 months thereafter. Now, the vitamin D types are important to remember. Again, 25-hydroxy vitamin D is the major circulating form. Ergocalciferol, which is vitamin D2, is what we get from our diet supplements. Cholecalciferol D3 is what we get from sun exposure. So again, D2 and D3 are the precursors to the active form of vitamin D, the 125-hydroxy D. But it's the 25-hydroxy D or the 25-OHD that is the best assessment of overall vitamin D status. The 125 is the active form that engages with the vitamin D receptor, but we're not really testing for that because it has a relatively short half-life. So we know that vitamin D it helps improve or prevent against various diseases, and then of course in a deficient state we're at increased risk for a wide variety of things. That doesn't mean everybody's going to get these, but it increases the potential from diabetes to multiple sclerosis, cardiovascular disease, different autoimmune disorders, etc. And so the Great Plains test does a nice job. It's got some good information about different ranges that are linked to severe deficiency, moderate deficiency, and then optimal levels, which most authors describe anywhere between 40 to 80 nanograms per ml or 100 to 200 nanomoles per liter if using international units. Okay, so we're looking again for that 40 to 80 nanograms per ml or 100 to 200 millimoles per liter as a target. And I think a good target is that 50 range, that 50 nanograms per ml. Now, there are scenarios where the levels can actually be elevated. So in this particular case, this was actually a child taking vitamin D. And you'll notice that their vitamin D2 is quite low, whereas their vitamin D3 levels are quite high. So they were actually taking supplements, but it wasn't registering high in the D2 level. We'll talk about that here shortly. Now, some of the main issues that can be related to vitamin D toxicity are hypercalcemia, which can cause nausea and vomiting, frequent urination, weakness. People can develop bone pain, as well as kidney problems, including kidney stones. So here we've got sun activation of 7-dihydrocholesterol, becomes D3 in circulation, and then D2 comes in from our diet. This then gets moved into the liver, okay, combining to make 25-OHD, which then gets converted to 125, or what's called 1-alpha-25 hydroxy-D. That happens in the kidneys. Now, one thing to notice about this particular slide is that it turns out that cholecalciferol can also be influenced. This is the type of vitamin D that is specifically often linked to sun exposure, but it turns out diet and supplements can have an influence on cholecalciferol levels as well. That's why that previous test that had high vitamin D was showing up elevated, even though it was the cholecalciferol. And then we got the ergocalciferol, which is the D2. And these then get converted to 25-hydroxy or 25-OHD, also called calcidiol. And the calcidiol then gets converted to 125-OHD or 125-hydroxy-D through an enzyme called 1-alpha-hydroxylase. And this particular gene, the CYP27B1, is influenced or has an influence on the function of that particular enzyme. And so it is certainly possible to have genetic variants in some of these enzymes, and that can lead to deficiency states or suboptimal states for some people. We can even have defects in the vitamin D receptor itself. And so notice that calcitriol, which is the 125-hydroxy-D, is the form that binds to the vitamin D receptor. And that's what has an influence at the cellular level, particularly at the nuclear level, on the DNA. Okay, and so we're basically having an influence on DNA for the production of certain proteins. And that is called the genomic influence or the genomic effect of vitamin D. We also can have a non-genomic influence, or I should say vitamin D can have a non-genomic influence in the cell. And how that works is it's not engaging the DNA at the nuclear level, it's actually engaging receptors either that are embedded in the cell membrane or second messenger systems that generally are located in the cytoplasm of the cell. And so that can have an influence on cell function, cell metabolism as well. One of the things that vitamin D does too is it helps in mitochondrial function. In fact, it's the vitamin D receptor that has an influence on mitochondrial activity and acts as a regulator over the preventing against excess production of reactive oxygen species, these free radicals that can get generated by normal mitochondrial activity. But the problem is that too much oxidative reaction, free radical formation can also have a damaging effect. So you can think of vitamin D receptor, having an influence on mitochondrial function as well. So there's a lot of things that vitamin D is associated with. So we actually have a website, which is a membership site for healthcare practitioners called Functional Medicine Clinical Rounds. And this is an opportunity for practitioners to join this membership site to interact with us one-on-one through lab one-on-one consults or the member forum. There's also educational material on this website as well. And so we can talk about vitamin D or other supplements or dietary intervention or lab testing or case reviews. Both myself and my partner, Dr. Trencatella, are part of the Functional Medicine Clinical Rounds website. As I mentioned, there are educational videos, there's a member forum, and then the ability to schedule one-on-one lab consults with us through this particular website. We have many courses through Integrative Medicine Academy, what we call mastery courses, from autism to hormones to functional medicine to candida, toxicity that addresses mold, chemicals, heavy metals. There's a host of courses that are very in-depth based on the principles of functional and integrative medicine that are available through Integrative Medicine Academy. So for more information about Integrative Medicine Academy and some of our mastery courses, you can go to integrativemedicineacademy.com. If you have any questions, you can email us at integrativemedicineacademy@gmail.com. Again, this is Dr. Kurt Woeller for Integrative Medicine Academy. Thank you.